Good evening guys, once again USMLE review videos. This is Dr. Paul, serving humanity through medical education, and let us go for some questions today. Which of the following causes chronic symmetric arthritis? Chronic symmetric arthritis. The choices are A. Lyme disease, B. Rheumatoid arthritis, C. Septic arthritis, D. Ganglion. Tell me your answer. Which one of those diseases cause chronic symmetric arthritis? The answer, guys, is B. Rheumatoid arthritis. You see, among these four things, Lyme disease, it does not cause chronic symmetric arthritis. Then septic arthritis is mostly unilateral. Then ganglion does not cause chronic symmetric arthritis. In fact, ganglion does not cause any kind of arthritis. It does not involve bones. It involves synovium. So the correct answer is rheumatoid arthritis. It is most often symmetric at presentation, and it particularly affects the wrists and other extremity joints that have a high ratio of synovium to articular cartilage. And now rheumatoid arthritis, the diagnosis is mostly clinical in its earlier stages. That's why in the earlier months of the disease, most often rheumatoid factor is negative. So rheumatoid factor negative does not mean that rheumatoid arthritis is absent. In its primary stages, rheumatoid arthritis has rheumatoid factor as negative. That's why most commonly we make the diagnosis on clinical symptoms. Now you can also think other causes like osteoarthritis. Osteoarthritis also causes chronic symmetric arthritis, but it's not given in the choices we have. Now osteoarthritis of the wrists usually involve the carpal metacarpal joint of the thumb primarily. So osteoarthritis and rheumatoid arthritis are two good examples for chronic symmetric arthritis. So the correct answer in this question is B. Rheumatoid arthritis. Okay guys, well, let's go to the next question. Which of the following medications is most effective in the treatment of intermittent claudication? The choices are A. Aspirin, B. Clopidogrel, C. Warfarin, D. Cilostazol, E. Pentoxifylline. So choose one. Which of these is most effective for the treatment of intermittent claudication? The answer is D. Cilostazol. Let's go one by one. Aspirin is an antiplatelet agent. Then B. Clopidogrel. It's also an antiplatelet agent. Now clopidogrel is more effective than aspirin, but still both of them are not as effective as cilostazol. Warfarin in fact is not used for intermittent claudication. So we are left with E. Pentoxifylline. Pentoxifylline is approved for the use of intermittent claudication, but it is less effective than cilostazol. So the answer for this question is cilostazol. Cilostazol, in meta-analysis of 8 randomized placebo-controlled trials, it was proved to be effective for moderate to severe claudication when you use it like 100 milligrams of drug twice daily. So it is the effective medication. It is a phosphodiesterase inhibitor approved by the FDA for the treatment of intermittent claudication. It suppresses platelet aggregation and is a direct arterial vasodilator. It appears to be more effective than pentoxifylline, And by the way, the side effects associated with silastazole are headache, loose and soft stools, diarrhea, dizziness and palpitations. And the contraindication, one contraindication you should remember is heart failure. Silastazole is contraindicated in heart failure of any severity. So those are the most important points when we talk about peripheral arterial disease or intermittent claudication.